Everyone, this is Dr. Brahim. Hope you are doing okay. I'm just on call and I have 20 minute break, so hopefully no one will believe me and I will try to make our third video in IMT training. Um, so I've done the first one in Arabic and second one in English. So this is the third video, and as far as I remember, I've mentioned about the application for the IMT and how you can prepare for it, how you can make the best use of your time in the training program if you are in the training program in your country, how to make the best use by doing some audits and teaching and get some evidences for it. Uh, Taking some courses, you will how you can write the application in an appropriate way that resembling the application for the English people, or the people who have done their medical school in UK. And I would just like to highlight some important point, that all the application is a way to get shortlisted for the interview, which means that the interview is the most important part of the whole journey. Okay? Yeah, the application is important, and all the point in the application is important, but this is just the start. So it will get you shortlisted for the interview, and you have to act well in the interview to get the job. Okay? And I would give a very small, simple, clear example in how you should prepare for the interview. For people who have done BLAB exam, BLAB 2, BLAB Part 2 especially, so people usually do academies and take courses and do online mock exams to get ready for the exam itself. What you have done for BLAB 2, you need to do a little bit of it for the interview. I mean by that, you have to do practice for the interview, and to know the important question for the interview, and to ask people about this interview is very important, because I would say this is the most important interview in your life, and it would cost you 1 year if you didn't do well in it. Okay, I mean, if you missed the IMT training this year, you will have to wait for the next year to apply. So it will cost you 1 year if you're willing to apply again, even. Okay? So it is very important to tackle the interview in the right way. Okay? How you would do it? As I mentioned, do practice, ask people. I've mentioned also about the interview book. Inshallah, we'll share this book with you soon in the group. I have a PDF copy of it, so I will share it with you. You can study from this book. It is very important for junior and middle grade interviews. Okay, so go through this book. There is a lot of important question, and its right answer. There is common question actually for the interview. I mean, it is like it have a structure. Okay, first, the first part of any interview, it will give you a couple of minutes to talk about yourself. Okay, so you have to talk about yourself in the right way. It is only 2 minutes, and it is not enough to tell all your story. Okay, so you have to choose the most important point, that it is appropriate and related to the IMT training, for example. Okay, uh, and try to do practice on that. Don't make it your first time in the interview. Okay, you have to do practice again and again and again, and try to, if there is some like online courses for it. I'm not aware of any online course, and I haven't taken any online courses actually. But if there is any online courses for it, if there is someone to do practice with, it is very important. Okay, so there is many question, and the answer is the same. Like, talk about yourself in 2 minutes. Show your commitment to specialty, or why you choose IMT training. All those questions are, the answer are the same. Okay, and the purpose and the reason for this question is the interviewer, the consultant, will need you to show the panel how you are committed to the specialty, and you are very serious about IMT. You want to do internal medicine, you want to do medicine in general. Okay, and it is not just a training, or it is not just like a long-term job. And no, they want you to show your commitment. So I would show my commitment in the right way, because this is very important. Everyone have a reason why he decided to go for medicine. Okay. Everyone like have a clear point in his mind that he chose to do medicine. Okay. You wouldn't do medicine as like a plan B, for example, or medicine always a plan A. Okay. Medicine is always a plan A for anyone. Okay. It's a hard it's a hard job. So for example, or I would give small hints. For example, I have done medicine in the medical school, like during my first year, fifth year. I felt very interested in doing medicine, and enjoyed the complexity of the disease and all this stuff. I would highlight that I have done like 3 months rotation during my internal year, or my foundation year, and also I've done other specialties, and I found that medicine. I found myself in medicine, or I feel that medicine is a specialty that I want to do in the future. And after that, after like doing or finishing my foundation year, I have done, maybe if you done like a training, or if you have a residency, or whatever you have done, I've done this medical rotation. I've done rheumatology. I've done general medicine. I've done emergency medicine, for example, and yeah. So it will show the commitment to the specialty. Even if you haven't done any medicine before and have done surgery, I have highlighted this before. If I done like 3 years of surgery and only 1 month of medicine, I would highlight it in this way. I have done 3 years of surgery, and those 3 years were enough to tell me that I'm not going for surgery. I'm a medicine man. Okay, so even if I've done only 1 week, so you have to convince the panel that you are committed to the specialty. There is some like scripted answer, and they know it and they don't like it, and you will see the reaction, the reflection on the panel when you like see this say this scripted answer. Okay, so try to think about it, why you choose medicine. Okay, even if you will use some of the scripted answer, try to do some modification in the way they will feel it is, yeah, it is real, it is realistic. Okay, one important point of being committed to the specialty, you started to do stuff related to the specialty. You started to do courses related to medicine. You started to do exams. I know a lot of people will say MRCB is not marked in the application, and they usually mention this in your application, that they would ask you about, have you done any MRCB exam? You would say no or yes, and they will mention in the same answer you wouldn't be marked for it. But believe me, in the interview they will mark you for that. I would say they might even give you the interview, the job. This will support you very in a very high way. So if you got the time to do the exam, the MRCB exam, do it. Okay. For example, you finish BLAB and you get your GMC registration, and you're waiting to get your first job in UK. Do MRCB at least part one. Why? Because this is the most and the clearest way that you might say, I'm very committed to internal medicine. I've done MRCB. Okay? So this is very clear. And at the same time, this will save you sometime during your training, because in IMT 1, you will have to do MRCB. By IMT 2, you have to finish all the MRCBs, the three parts. Okay? So if you have done part 1, or even part 1 and part 2, this will save you some time, and you might get signed off early during the IMT, and I will talk about this later on. Okay? So exams will show like that you are very committed to the specialties. Courses like echo, like ultrasound, like any other courses. Even if you have done one of the medical subspecialty, like I've done cardiology, for example, I would highlight the commitment to the specialty, and I would highlight that I would like to do cardiology later on, and I would highlight that IMT will give you the opportunity to know the system and to become to be more confident and more comfortable to do a medical registrar job, and after that to apply for the higher specialty training to do cardiology, for example, which is a specialty I want to do. Okay, so try to organize and try to give clear answer in the right time. Okay, because there is no time in the interview. Okay, that's it for now, and wait for the next video. I will give more advice about it. Thank you.